So this patient basically had a glioma operated. So this is a scan 1 year ago in 2019. You can see a focal diffusion maybe there, maybe not there, but no other lesion as such. I show you a flare, and there is a mild periventricular hyperintensity. There are signal changes around the resection. This is the area which was showing focal restriction, maybe diffusion, but that's too small to comment on. This is a coronal scan, and this might be that area of restriction, which is not really something which fits with the confidence to give it as a recurrence. So yeah, so it looks like just a clean cut resection without any area of recurrence. You want to confirm it, maybe you do perfusion, maybe you do contrast. We have a contrast here. Come on now, don't load so much. Is my network? Suppose it was so. Alright, so always the issue with a lot of images been loaded, right? Yeah, fortunate. Right? So until it's getting loaded, so this patient has this operated in 2014, and this is already 6 years into the course. So that time it was diagnosed as a low-grade glioma, most likely a low-grade glioma because the patient is alive more than 5 years now. So good 5 years survival, so to speak. Right. Okay, come on now, we are almost there. Okay, so there is this section thing and not much announcement or anything. Okay, cool. So there you have it, the lesion, no enhancement, nothing, just a post-op cavity kind of thing. That's it. Now let me show you the MRI which was done today on December 12, 2020. Now again, this is a patient whose MRI was done today, and I just showed you the MRI 1 year back, and now this is diffusion MRI images. You can see the cavity here, and you are thinking, okay, this is looks normal, but boom, you can see there is a lesion here, and it's showing apparently restriction of diffusion. Now you're confused whether it is true restriction of diffusion or not, so you want to be sure about that. So you take the help of ADC values, and you go up, and you're seeing, boom, it is showing restriction of diffusion there. So you want to confirm it, you advise perfusion imaging and spectroscopy. At the same time, you want to see it under another sequences, so to speak. Then on T2, so the thing is, this is T2 ISO to hypointense, which is suggestive of higher cellularity. At the same time, this was appearing showing restriction of diffusion, so again suggestive of higher cellularity. So we are pretty sure that this is recurrence. At the same time, now I want to see T1 weighted images so that you will able to compare it with the post contrast things. Okay, it is there, iso-intense T1. Uh, Let us compare it to the post contrast here. Alright, so this is a post contrast image. I'm not expecting much enhancement, though there is a bit of enhancement going on, and which wasn't the case previously, mostly vessels and all. I want to see pre-contrast again, just get things in the perspective. So the lesion is here, and enhancement thing is I felt enhancement was more medially, yeah, I guess, but at the same time, the same position almost. I guess subtracted maps would have helped, but we don't have that unfortunately. And then finally, I will show you the T1 coronal images, sorry, T2 coronal images. And you can see right here, which was not present, which wasn't present on the previous scan. You can see this gyral thickening, and if you could have that previous scan feeling, you can still try to correlate them, and you can understand that there was a lesion here, a very small, which was showing a bit of restriction of diffusion, and we were not sure to call it that or not. I will just check it out once more to show you. And look at that. This is the same. Yeah, this is the same slice. You go behind, you have a bigger cavity. Go in front, you have the relatively smaller one. And this is where the recurrence is. These small virus, which was left with radiation and stuff, which has formed a tumor now. Alright, so that's this case. Most likely a recurrent glioma, and looking at the cellularity, looks like hypercellular one. So secondary glioblastoma cannot be ruled out. That is what I would write in my diagnosis. I call the patient for MR spectro and perfusion. Will tell you how it goes. Thank you for your attention and have a nice time. This case was to demonstrate how important it is to get the previous scans. It is really of great significance to get the scan which was done before, because then it makes your life so much easier, to compare and give a diagnosis. So keep that in mind, and thank you.